My name is Ayyadurai. My nurses and my colleagues call me Ayya. Ayya is my short name. I was trained in New York at Mount Sinai Hospital. That is where I did my cardiology training and my fellowship. I did my internal medicine training also in New York City. I moved to Grand Forks in 2020. This is my third year in Grand Forks in Altru Hospital, and I'm a non-invasive imaging cardiologist. I specialize in reading cardiac CTs, cardiac MRI, and I also read echocardiogram, and I also read stress test and nuclear imaging. So cardiac MRI scanning is a simple MRI scanning process which kind of takes around like 30 minutes to 40 minutes for scanning. Here the patient lies in an MRI scanner and you are asked to hold your breath for certain scanning sequences. Mostly you have to hold for like few seconds, maybe up to 5 seconds, and then the MRI scanner takes pictures of your heart. In the last, I would say like 1.5 years, we had like almost like 50 patients out of this 200 whom we scanned, for whom I think the MRI made a big difference. We could diagnose things which were not diagnosed before, and their treatment process totally changed. In other words, we were able to diagnose disease which was already existent in the community, which could not be done in the past because we didn't have the cardiac MRI in Grand Forks in the past. Now with this newer scanner, we are diagnosing newer problems or like the existing problems which were hidden, and we are able to treat them at an earlier stage, and then in this way we are able to help our patients. We started this cardiac MRI program in Altru Hospital in 2021 in the month of March. It's been almost 1.5 years since we are running this program, and it has been an excellent experience, and we have scanned almost around 200 patients. We have a latest 2019 Siemens era model, which is one of the latest scanners for scanning cardiac MRI, and we are the second in the state of North Dakota to do this cardiac MRI. And with the advent of cardiac MRI in the Grand Forks area, we have got answers for many patients for whom we did not know why they had heart failure. If you have a metal in your body which is not compatible with an MRI scanner, it becomes a contraindication. The other common relative contraindication is if you are severely claustrophobic. If you cannot tolerate closed spaces, then it becomes kind of difficult to do the cardiac MRI scanning. 4 out of my 5 patients who have claustrophobia, they do very well with this scanning process with mild sedation. Like these medicines kind of relax your nerves, and then it is kind of easy to get the MRI done. And so I would give it a try, like with like simple like sedatives if you have mild to moderate claustrophobia. But if you have severe claustrophobia, then I would look for other modalities to assess your heart. Cardiac MRI for the most part is a safe scanning process, and also it's a non-invasive scanning method, which means we don't pass any catheters in your body, we don't cut you or skin. It is very simple. You're going to lie in a scanner and we take pictures of your heart with the cardiac MRI scanner. I would say cardiac MRI has a great future, and I think in the next 5 to 10 years, the scanning time, which takes around 40 minutes nowadays, is going to come down. Like we might be able to do an MRI scan maybe like in 15-20 minutes in the future. And with the novel innovations in the scanning engineering, I think with the newer scanners and with the newer protocols, I think we will be able to detect heart failure in the earlier stage with the cardiac MRI. I think the best way to start is to start with their primary doctor and possibly get seen by the cardiology specialist. The cardiologist are the group of doctors who are very well trained in taking care of your heart.